Alrighty, so I'm gonna go ahead and do the eye assessment on you. So we're just gonna begin by assessing for symmetry and just looking at the various structures of your eye as well.
Okay.
Pupils look good and dilated. I'm also gonna be looking for Perla, which is pupils are equally rounded and react to light accommodation. So I'm gonna just be looking at how your pupils dilate.
Okay.
And I will also be doing the corneal light reflex. So if I could just have you look past my shoulder into
Okay.
into the distance, I'm gonna shine this equally into both eyes, and what I'm looking for is equal placement, I guess, of the reflection in both your eyes. This will just show any ocular abnormality, I guess.
I was going to say problems, but
yeah.
abnormality.
Okay, there you go. And then I'm also going to assess your extraocular movements. So just follow my finger just using your eye, please.
So what? Move my eyes with your finger?
Yes.
Okay. Oh, you're pretty fast. Okay. Ooh.
All right, very good. And then I'm going to assess, I would be shining my light in and looking for pupil convergence and your red reflex in your eye.
Okay.
I'm just going to pretend that I'm shining this in to your eye.
Okay, and I'm looking straight ahead, right?
Yes, that is correct. Okay, and then I'm also going to do a test that will assess for strabismus or just any abnormalities of your eye motion.
Okay.
So it's called the uncover test.
Okay.
So you can just keep both your eyes open.
Okay.
I'm going to cover up one eye.
Am I looking straight ahead again?
Yeah.
Okay.
And the other eye. Okay, and that looks normal as well. And that will conclude the eye assessment.
Okay. What are we doing? Okay.
Okay, so now I'm going to go ahead and do your ear assessment using the light as well. I would be typically using an otoscope, but I'm just going to, again, kind of assess structure of the ear. I would take my otoscope and shine it in your ear and be looking for, again, the internal structures of your ear, also looking for any abnormalities or problems and locating the tympanic membrane, which should be a translucent gray color.
Okay.
So that is what I would be doing with the ear examination.
Okay.
I'm also gonna be just feeling for any tenderness. It doesn't hurt or anything.
Nope.
Okay, very good. And then we're gonna perform a test that will test bone versus air conduction. This is my tuning fork. I'm going to activate it and then place it on your head. Let me know when you feel the vibration stop.
Okay. Okay, I just stopped.
Okay, good. And then I'm gonna do the Renee test, which is bone versus air conduction, and same thing, just let me know when you hear it stop.
Okay. Okay, it stopped.
Okay, and then do you hear any vibrations?
No.
Okay, very good. That is all normal.
Okay.
Okay, I'm gonna go ahead and inspect your neck. We're just, again, looking for any abnormalities, anything that looks problematic, but it looks good here. I'm also checking for neck vein distension, which would be indicative of heart problems, but that looks fine. And then I'm gonna go ahead and palpate for lymph nodes, which would start up here by the temple area and then down to the neck, just feeling for any lumps in there, but again, feels good. I'm going to also just feel here for the thyroid, around your trachea. Could I have you swallow me, please? Okay. good. And
I got a big Adam's apple.
going to auscultate your carotid. Okay. And then also, we'll just palpate the carotid arteries, or feel for that one at a time. Okay. Okay, and then lastly, I'm gonna assess your cranial nerve 11, which is the spinal accessory nerve. So if I could just have you lift your shoulders like you're shrugging just against the resistance of my hands.
Okay.
Okay, very good.
Okay.
And that will conclude the neck. All right, so we're gonna go ahead and listen to your heart and just do the cardiovascular assessment. So I'm gonna start off with an inspection. This would just be of any lifts or heaves in your chest, any pulsations with your breathing or anything going on there, but it looks normal. So I'm gonna go ahead and auscultate for heart sounds. In these 5 locations. And this is your apical pulse. Should be the loudest. Yep. And then I'm also going to, I'm going to just palpate here for your apical pulse. And then also I will auscultate the apical pulse while palpating your carotid. This will assess for dysrhythmia. Okay. Everything's sounding good. And then all right, that will conclude the cardiovascular. Okay, I'm gonna go ahead and do your abdominal assessment. So if I could just have you lie down,
Okay.
please.
Shirt still on?
Yes.
Okay.
Good. I'm gonna take a look for any abnormalities here, but it looks good for my initial inspection. I'm gonna auscultate for vowel sounds in each of the 4 quadrants, starting in the right lower quadrant. Okay, and then also I'm gonna use the bell and auscultate down the center. And hearing vowel sounds is normal, so that is good. And then I'm going to be percussing each quadrant, just as I had listened to it. And then I will also be percussing the border of the liver and then the spleen as well. Okay, and then lastly, I will be doing light palpation of each quadrant. Is there any tenderness? Okay.
Nope.
Light palpation, and then a little bit deeper. This will assess for any hernias, like that. Okay, and then I'm gonna also feel in the lower left quadrant. This would be for rebound tenderness. So when I lift up my finger, does that hurt? Is it tender? No?
No.
All right, very good. All right, so I'm gonna go ahead and assess your lower extremities. So I'm looking for things like edema, varicose veins, feeling for the temperature here, and every capillary refill on your feet. I'm also going to feel for the pulse that is here in your malleolus. It's kind of hard to find. And then the pedal pulse, which okay. And clubbing is indicative of oxygen deficit, but everything looks good here.
What is clubbing? Which way does it go if it's clubbed?
It would be like your nails are mounded, kind of.
Oh, okay.
Okay, varicose veins and edema. There's nothing to make note of. Okay, very good. All right, now we're going to go ahead and do the neurological assessment. So I'm going to start by assessing your gait. If you could go ahead and stand up for me,
Okay.
and just do heel to toe walking. You can just walk.
Just
back.
a regular step?
Yeah.
Heel to toe?
Yeah.
Like this?
Yes.
Okay, heel to toe. Well, the carpet's a little soft, but
Then you can go ahead and come back. And this just assesses your balance and very good. Okay, and then I'm gonna have you walk on your toes going and then on your heels coming back.
so just tippy toe?
Yeah.
Okay. Full steps?
Any issues with balance?
No.
All right,
And
and
then
then on your heels. All right, very good. You can stand right there. I'm gonna do the Romberg test. I will actually have you face this way,
Okay.
and I'm gonna have you close your eyes,
Okay.
and I will just be seeing if you can stand in this position without much swing, which you're doing an excellent job. Okay,
All right.
that seems very normal. All right, go ahead and open your eyes.
Okay.
And then I'm gonna have you can take a seat. We're gonna do the pronator drift, which is where I'll have you close your eyes again, but you're gonna be sticking your arms out with your palms up.
Straight out like this?
Yeah,
Okay.
with your eyes closed. And then I will be assessing. And if there's a positive test, which there isn't, you can go ahead and open your eyes.
Okay.
A positive test normally would have the palms rotate in, but you're balanced, and that was good.
Okay.
That test. So, I'm gonna do some sensory stuff. So, if I could just have you once again close your eyes.
Okay.
And just put out the palm of your hand. I'm going to write a letter in your hand, and you're going to tell me what it is, and this is facing you.
Could you do it one more time?
Sure.
I think it's a F. It's facing me.
Yeah.
It's not an F.
If you get that
Is it an H? No.
no.
T? I don't have very good sensory perception.
That's okay. I will make note of this.
Maybe I'll be better on my left hand.
No, it's okay. And then I'm gonna go ahead and just
What letter was it?
it was A.
Oh,
And then if you could again close your eyes, one more sensory test. I'm gonna just place something in your hand and you let me know what you think that is.
oh, it's a pen or a pencil. Pen.
All right, very good.
Yep.
And then go ahead, open your eyes. One more part of the neurological exam. If you could just have your palms, you can put it on your like that,
Okay.
and then just flip them over and keep doing that motion as fast as you can. Very good.
Okay.
Okay, and then if I could just have you hold out your hands like this, and you're going to try and just touch each of your fingers to your thumb.
Okay. Like this?
Yep.
Backwards the same way?
All right, you did that with ease. Very good. Okay, and now we're going to go ahead and assess for deep tendon reflexes. So that'll be for your triceps, brachioradialis, Achilles, patellar, things like that. So we're going to pretend this is
That
my,
hammer?
yes.
Okay.
So if I could just have you come out like this, and we're gonna, sorry.
No, that's right. It moved.
Yeah, and then I'm gonna have you flip your arm around. Okay.
Okay.
And we're gonna do the patellar and then the Achilles as well. And then the last deep tendon reflex is called the Babinski reflex. Sorry, this might tickle a little, but okay, very